I'm going to do incentive spirometry checkoff. So always before entering the patient's room, I want to verify my order within the chart. Maybe take a quick peek at their chest x-ray. If I can coordinate with the nurse of when she gave pain meds last, I would maybe do therapy 30 minutes after she had given them. I grab my supplies so I'm ready to go into the patient's room. I will sanitize and glove up, introduce myself to the patient. Hi, I'm Tiffany. I'm from respiratory. I'm a respiratory care student. The physician ordered incentive spirometry today. What that's going to do is it's a lung volume expansion therapy, and it's really going to get your lungs opening up and deep breathing. Can I get your name and date of birth? After the patient verifies themselves with me, I'm going to assess their heart rate, their respiratory rate, their breath sounds, their SpO2. If they have any sort of fresh incisions or if they're having a little bit of pain, I could recommend splinting with a pillow. We want to measure their tidal volume, their inspiratory capacity, and their slow vital capacity on a respirometer. When instructing the patient on how to use the incentive spirometer, I'm going to tell them that they want to put their lips around the device here, and they want to take a nice slow deep breath in through their mouth as much as they can get in. Hold it for 3 to 5 seconds. Exhale slowly. Take a little break and repeat that about 6 to 10 times. You don't want them to go too quickly or too fast because they could hyperventilate. Now, in with the incentive spirometer, there is a sheet. It goes off of the patient's gender, height, and age. And what that does is, I'm 5'9", 30 years old and female, so my goal, according to the sheet, is 2,900. You want to make sure the patient gets at least a third of their goal. If they can't get a third of their goal, then you're going to have to look at another lung volume expansion therapy, such as the EasyPap or AccuPap, and speak with the physician and get it changed if they can't reach that goal. You want to make sure the patient has proper technique when doing this. Evaluate the patient, give them any tips. When they're done, you want to always reassess them as well. Maybe also instruct them when they're done doing that, deep breath in, holding, and exhaling, to give a good cough. See if, they can really get that going. So I'm going to demonstrate for you. Like I said, my goal is 2,900, so let's see if I can get it. Now also, you want your patient to stay in between the best and better on the left here. That tells how slow they're breathing in. If they're breathing in too quickly, it's going to jump up. I think I got around my goal. I really didn't see too well. I was focusing on deep breathing in. So yeah, again, hourly for the patient, about 6 to 10 times. Make sure they're taking breaks and evaluate their technique. And